I am the Director of Robotic Gynecology for UPMC and also a member of the Urogynecology Division, primarily headquartered out of Magee Women's Hospital here in Oakland. And I have been involved with the Robotic Oversight Committee that is multidisciplinary throughout UPMC, which really brought me into friendship with people like Uma Duvari and Netu Sakaria. And working closely with them, I have become involved with Pittsburgh Creates, which is a nice incubator that allows us to interface with each other, with industry, with engineers from the university, and has created sort of a unique environment for us to use our creative energy, not just individually, but collectively, to develop new things and take our ideas from the idea phase into reality. I have been involved with robotic surgery since 2008 and have done over 1,000 robotic procedures. I have utilized at times either in a lab setting or in a clinical setting the Da Vinci robot platform by Intuitive, the Senhance robot platform by Transenterix, the Versius robot platform by Cambridge Medical Robotics, and the MedRobotics robot as well. So I have experience with lots of different platforms and have worked with several of those companies on the developmental end, as well as obviously a lot of clinical experience. It just gives us an opportunity to brainstorm with each other as well as with the corporate entities to think about what they think their needs are, for them to interface with us about what we think our surgical needs are, and then we have access to work with them to develop new instrumentation, for example, to think about new ways to improve surgery, to take technology that would allow us to get a patient potentially a better outcome, or more patients have access to what we do. We have developed this system of teleproctoring or telementoring where we are able to have a virtual presence in an operating room that is remote from where we are. So I get asked to teach surgeons robotic procedures throughout the system, whether that's in Erie or Altoona or north of Pittsburgh or south of Pittsburgh or here in Oakland. And it becomes cumbersome to always be physically present. And so what teleproctoring has enabled us to do is allow surgeons the flexibility to schedule procedures on days when someone like me, a mentor, doesn't have to physically be present or travel to that town. So we can be here in Oakland, and through the use of computer technology and the telementoring technology that we've developed, we can have a virtual presence in the operating room where we can speak back and forth. We can see what's happening in the entirety of the room. We get the intraoperative feed from the robotic device as well, and the surgeon can ask us questions. The operative team can ask us questions. We can answer those. We can ask them questions and advise on anything from patient positioning to surgical technique to various things that come up during the course of an operation. So it's really allowed us to expand the reach of our teaching. My vision is that we would ultimately be able to assist remotely, that not only would we be able to advise, but we would be able to participate. And I think that will be on the horizon. We are not that close to that moment yet, but we certainly are working toward that, and with our industry partners continue to work toward that end. Creates has enabled us to really develop these ideas, and I feel like there's a lot of momentum for something like that. The UPMC system sets up well for it because it has a large geographic footprint, and we can help surgeons within the system now with remote advice giving and teaching, but hopefully at some point with actually assisting remotely. We'll just continue to grow, continue to add partners, continue to attract new industry partners. I think word and momentum has really built about what we're doing here, and it's more and more industry partners are reaching out to us for collaborative ideas and potential partnerships, and I think that will continue to expand.